Hey everybody, my name is Kim Griffiths. I'm a student physical therapist assistant at Jeff State, and today I'm going to be talking about vancomycin resistant enterococcus. Vancomycin resistant enterococcus, or VRE for short, is a strain of bacteria that is resistant to an antibiotic known as vancomycin. This strain of bacteria is normally present in the GI tract, the female genitourinary tract, and on our skin. So this is a bacteria that occurs normally in the body, and it's something that is always naturally there, but what happens with VRE infections, the mechanism of this disease process is the use of broad spectrum antibiotics. and eliminates this normal flora that we have present in our GI tract, and this allows for the elimination of that flora allows for the proliferation of the enterococcus bacteria. These VRE infections, they occur mostly in hospitals, intensive care units, skilled nursing facilities, and acute care facilities. So these infections are also known as nosocomial infections. Another thing about VRE is they are acquired through the mutation of foreign genetic material through the transfer of plasmids and transposons, as well as changes in the peptidoglycan formation that makes up the bacterial cell wall. What this means is vancomycin essentially binds to the bacterial cell wall in an effort to achieve its antibiotic effect, but the bacteria is resistant because they synthesize different cell wall intermediates. VRE, they're able to survive in hospital environments due to their resistance against commonly used antibiotics, as well as their ability to acquire resistance to other antibiotics. So not only are they already resistant to one commonly used antibiotic, it's really easy for them to develop resistance to other antibiotics. So this bacteria is a really hard one to treat. People at risk for VRE are those that have been on a long course of antibiotic treatment or have had an extended hospital stay, have a weakened immune system, potentially due to acquired disease or undergoing chemotherapy. Also, patients who have undergone surgical procedures that require an incision, they are really susceptible to this bacteria because there's an opening in the skin where that bacteria can get in. Also, patients with medical devices such as IV lines or urinary catheters, arterial lines, and then central venous lines, they're also more susceptible to acquiring a VRE infection due to there being an opening or an incision in the body that's not normally there that the bacteria can enter the body through. This occurs because the devices, of course, are disrupting the normal mucous membranes and the skin barriers, so that makes infection more likely. The elderly, they are also more susceptible just because of their weakened immune systems. Just like you always want to be careful in general with elderly patients, just because they are weaker, they are more susceptible to this. However, VRE infections, they can occur in any age group, and they don't tend to occur more in males versus females. Medical treatments that you can use to treat VRE, it kind of depends on what the bacteria necessarily causes. The bacteria is present but can have multiple different effects on the body, such as it can result in wound infections, UTIs, blood infections, endocarditis, which is just inflammation of the endocardium in the heart. It can also cause intra-abdominal infections, pneumonia, abscesses, and meningitis. Treatment depends more, like I said, on that underlying disease caused by the infection itself. Enterococcus responds to ampicillin and aminoglycosides, yes. But it is becoming increasingly resistant to these over time. For patients with endocarditis, ampicillin combined with gentamicin is the recommended treatment. However, it could, like I had mentioned earlier, it is becoming resistant to ampicillin. Diagnostic testing for VRE typically requires a sample taken from blood, urine, the stool, or an infected wound if there is one present. These samples are then sent to a lab where the bacteria is grown and tested to determine what antibiotic can kill it. Prognosis, like I kind of mentioned earlier, dependent upon the underlying disease caused by the infection. For instance, heart valve infections can occur. The endocardium of the heart and the heart valve itself, they're kind of similar. And So the infection of the endocardium can affect the heart valves. And so these infections, they can take up to 6 weeks of antibiotic therapy, as well as an extended hospital stay of an additional 2 weeks. So, and this is kind of where the therapy comes into play, because this extended hospital stay, you're on a 6-week course of antibiotics. Also, this bacteria, is really contagious. So these patients, they're typically staying in their bed trying to get rid of this infection. They're not allowed to be around other patients. They need to be on isolation precautions to prevent the spread of this bacteria to other patients. So they're bedridden, they're not doing a lot of moving around, and this can result in loss of function. So, following the layout of the Nagy model, vancomycin-resistant enterococcus, is the occurring pathology, and the impairment that can result from it is endocarditis, which affects the inner lining of the heart, as well as the valves, as I mentioned earlier. So functional limitations that can result from endocarditis are fatigue, shortness of breath, chest pain, decreased tolerance to exercise or to be able to just perform activities of daily living. So therapy will come into play with this to kind of improve cardiac function, build up those muscles that have lost their weakness as they were trying to kick this infection out of their body and be on bed rest. Disabilities likely to occur from these functional limitations that they've experienced is inability to walk long distances, such as what they might have to do to work or to go grocery shopping or to even just get into their house, to climb the steps to get into their house. So aerobic exercise can counteract the effects of not being able to move around as much while this infection was running its course. It can also strengthen lower extremity muscles just to be able to help assist the patient get back to function. New step therapy bikes are a great way for patients to also increase endurance and increase muscle strength that they might have lost. And new step bikes are another great tool for physical therapists or physical therapist assistants to utilize, because they can monitor patients' cardiac function to see how they are responding to these exercises, and they can adjust accordingly. A precaution that you want to watch out for with VRE, especially if it's caused endocarditis, and the reason I mention endocarditis so much is because research has shown that endocarditis is the most common pathology that results from VRE. So that's why I'm talking about endocarditis so much. So something that can occur is vegetation. And what this is a mixture of bacteria and blood clots that develops on the heart valves. And a precaution with this is patients with this newly developed vegetation, they should receive, if it's part of their plan of care, they should receive pulmonary hygiene procedures with extreme caution due to this vegetation. What can happen is this vegetation can dislodge and it can cause an embolic stroke. Like we all know, the presence of blood clots should be very careful. If there's any suspicion of a blood clot, you don't want to continue with therapy. You want to halt therapy, and you want to let the doctor or the attending PT know. So, endocarditis resulting from vancomycin-resistant enterococci infections fall under pattern 6A in regards to physical therapy practice. Due to the nature of endocarditis, this disease can affect the patient's endurance, their blood circulation, their normal respiration. You want good cardiac function during therapy, of course, and this can all affect the body negatively and make it harder for them to perform any physical therapy they may need. So this is something that us as physical therapist assistants need to keep in mind if they do have VRE. Also, just keeping them under isolation, and if necessary, working with them just in their room and taking care to prevent that spread of infection. So, as mentioned earlier, the VRE infections, they can have various effects on the body. So you just want to play it by ear as far as that patient's particular diagnosis, and also mainly just keeping them under isolation. So that is all for my presentation today on VRE. I hope you enjoyed it. Thank you.